Ever since his surgery in 2012, Lee Passmore has lived in chronic pain. He can't feel his feet, his right leg is stiff, and he struggles to walk. But he's one of the lucky ones. He could be dead. Passmore was the first in a long line of patients who ended up being maimed or killed by Dr. Christopher Duntsch. During 2 years of practicing medicine in and around Dallas, Texas, Duntsch operated on 38 patients. 33 of those patients were injured during or as a result of the surgery, some suffering rare or unusual complications. 3 patients died, 2 in the hospital within hours of their surgery. As Duntsch's negligence and failures began to come to light, a magazine published a cover story with the headline "Dr. Death." The nickname stuck. So what went wrong? After the first few botched surgeries, why was this incompetent doctor allowed to continue to perform operations? Was anyone paying attention? Ultimately, when authorities finally looked into Duntsch's history, they were shocked at how he had flown under the radar time and time again. Let's start at the beginning. After receiving his undergraduate degree in 1995, Duntsch enrolled at the University of Tennessee at Memphis College of Medicine in an ambitious program to earn both an MD and a PhD. He earned his dual degrees in 2001 and 2002. Duntsch was tall, confident, some would say arrogant, and had a persuasive charm when he talked. While not the brightest, he had a reputation as a hard worker. Although much later in sworn testimony, an ex-girlfriend of one of his closest friends claimed Duntsch liked to party. She described a drug-fueled all-night birthday celebration for Duntsch about midway through his residency. Apparently, partygoers snorted cocaine, popped pills, and drank. Early the next morning, Duntsch slipped on his white coat and headed out for rounds at the hospital as usual. Duntsch also took part in a neurosurgery residency program at the University of Tennessee Health Science Center and subsequently completed a spine fellowship program there as well. As part of the program, Duntsch worked in a research lab studying stem cells. For a while, he pursued a career in biotechnology and even worked for a company exploring the potential of stem cells. However, he eventually fell out of favor with his colleagues and was forced to leave. Per the Accreditation Council for Graduate Medical Education, a neurosurgery resident does about 1,000 operations during training. But according to records, by the time Duntsch finished his residency and fellowship, he had operated fewer than 100 times. Once Duntsch's negligence came to light, the media reached out to the University of Tennessee. The school, citing student record confidentiality, wouldn't comment on Duntsch. Off the record, the chief of neurosurgery at the hospital where Duntsch did his residency said that there was once an anonymous complaint filed. Allegedly, Duntsch was impaired by drugs while seeing patients. Duntsch ended up being sent to a program for impaired physicians. Afterwards, he was allowed to continue his surgical training under close supervision. In the summer of 2011, Duntsch took his first job as a practicing physician at the Minimally Invasive Spine Institute in Plano, Texas. He also received privileges to operate at Baylor Regional Medical Center. The hospital gave him a base salary of $600,000 a year for 2 years. A lot of money to be sure, but not unusual, as neurosurgeons bring in millions in yearly revenue in hospitals. Both workplaces had received glowing recommendations from Duntsch's medical school. Within a few months, Duntsch had been dismissed from the Spine Institute for dereliction of duty. Duntsch had gone to Las Vegas on a weekend he was supposed to be looking after a patient he had operated on. However, Duntsch still had operating privileges at Baylor Plano. In the winter of 2011, 36-year-old Lee Passmore saw a pain management specialist. Previously, he had back surgery. Unfortunately, the pain had returned. His pain specialist advised against having another operation, but then mentioned that he had recently met a neurosurgeon and gave Passmore Duntsch's card. On the 30th of December 2011, Duntsch set out to perform an anterior-posterior lumbar fusion surgery on Passmore. The procedure uses metal implants and bone grafts to stabilize adjoining vertebrae. A vascular surgeon, Dr. Mark Hoyle, was on hand to assist with the operation. It was Hoyle's job to open Passmore up and sew him up. Hoyle began by making a small incision just above Passmore's groin. He moved the blood vessels and organs all out of the way, allowing Duntsch clear access to the lower spine to remove a herniated disc, which was pinching a nerve. Hoyle watched in alarm as Passmore began to bleed profusely when Duntsch began to cut a ligament around the spinal cord, not typically disturbed in such spinal fusion procedures. As the surgery continued, Hoyle became more and more concerned with Duntsch's actions. Eventually, he blocked Duntsch from continuing the procedure because he felt that irreversible damage was being done to the patient. Then Hoyle left the operating room and vowed to never work with Duntsch again. 45-year-old Barry Morgoloff was Duntsch's next patient. Morgoloff had worn his back out unloading trucks for his father's import company. During his appointment with Duntsch, Morgoloff was impressed with his easy manner and confident promises to fix Morgoloff's back. On January 11, 2012, Duntsch performed an anterior lumbar spinal fusion on Morgoloff. Dr. Kirby, the assisting vascular surgeon, observed that instead of using a scalpel, Duntsch tried to pull Morgoloff's problem disc out with a grabbing instrument that could damage the spine. Dr. Kirby argued with Duntsch and then left the operating room. When Morgoloff awoke, he had searing pain in his back and left leg. Several months later, he had to have a second operation to remove bone fragments lodged in his spinal canal caused by the first operation. The repairing surgeon fixed what damage he could, but to this day, Morgulov still walks with a cane. As scar tissue builds up, Morgulov's pain will worsen and his range of motion will decrease. One day he will likely be in a wheelchair. Throughout the spring, Dunch performed several more surgeries. In February, he performed an elective spinal fusion on Jerry Summers, his roommate and childhood friend. Jerry suffered from chronic pain from a high school football injury that had gotten worse after a car accident. After surgery, when Summers awoke, he was a quadriplegic. According to doctors who later reviewed the case, Dunch had damaged Summers' vertebral artery, causing massive bleeding. To stop the bleeding, Dunch packed the space with so much anticoagulant that it squeezed Summers' spine. Summers made the startling claim that the night before the surgery, he and Dunch had done cocaine. Later, he would recant under oath, explaining that at the time he just wanted to make trouble for Dunch. However, Baylor Plano took the accusation seriously and ordered Dunch to take a drug test. Dunch missed his test appointment, telling administrators he got lost on the way to the lab. However, he passed a separate psychological evaluation and after 3 weeks was allowed to operate again, but he was told to stick to relatively minor procedures. In March, Dunch operated on Kelly Martin, a school teacher who had a compressed nerve from falling off a ladder while trying to retrieve Christmas decorations. She went to Dunch for a laminectomy, also known as a decompression surgery, a straightforward, common procedure. However, within a few hours of her operation, Martin bled to death internally. An autopsy discovered that Dunch had cut a major blood vessel in her spinal cord, but the death was ruled accidental. Baylor Plano again ordered Dunch to take a drug test. His first screening came back diluted with tap water, but a second, taken a few days later, came up clean. Hospital administrators also organized a review of Dunch's cases. As a result, they ended his operating privileges at the facility. However, Baylor Plano allowed Dunch to resign rather than be fired. Since Dunch's departure was technically voluntary and his leave had been for less than 31 days, Baylor Plano was under no obligation to report him to the National Practitioner Databank. Established in 1990, this database tracks malpractice payouts and adverse actions taken against doctors, such as being fired, barred from Medicare, handed a long suspension, or having a license suspended or revoked. Medical facilities and state licensing boards are required to query the database when considering applicants for clinical privileges. Basically, the database is supposed to prevent bad doctors from moving from hospital to hospital. However, sometimes hospitals will allow a doctor to resign instead of dismissing them. The hospitals worry about perceived legal liability. Reporting a doctor might hurt their job prospects or even prompt lawsuits which will blow back on the hospital. So if possible, some hospitals will invite a bad doctor to resign and sweep the mess under the rug. Baylor Plano's decision to not fire Dunch and also not report him to the Texas Medical State Board had a devastating effect. Dunch moved on to Dallas Medical Center. On July 24, 2012, Dunch operated on a 64-year-old Floella Brown, a retiring banker. During the surgery, Brown bled so much that the operating room nurses had to put towels on the floor to soak up the lake of red. After the operation, Brown woke up and seemed fine, but several hours later she lost consciousness. Pressure was building inside her brain. She was moved to the ICU while doctors tried to figure out what was going on. While Brown was still in the ICU, Dunch performed another surgery on active 71-year-old Mary Eford. She had sought Dunch's help because she was experiencing back pain when trying to use the treadmill. Brown never regained consciousness, and within a few days her family removed her from life support. Later, an investigation would find that Dunch had both pierced and blocked her vertebral artery with a misplaced screw. Eford woke up from surgery in agony. She couldn't turn over or wiggle her toes. The hospital called Dr. Robert Henderson, a Dallas spine surgeon. When Dr. Henderson performed emergency repair surgery on Eford the day after her original surgery, he was horrified at how badly it had been botched. Unfortunately, he could only do so much to repair the damage. Eford never regained her mobility and now uses a wheelchair. Within a week of the two surgeries, hospital administrators told Dunch he could no longer operate at Dallas Medical Center. But just like Baylor Plano, Dunch was allowed to resign and the hospital didn't notify the National Practitioner Databank. However, by this time, other physicians had taken note of Dunch's track record. Dr. Hoyle, who had once assisted Dunch on a surgery, submitted a complaint to the Texas State Medical Board. Dr. Henderson began to investigate Dunch on his own and contacted some of his former co-workers and professors to get a better picture. But Dunch was able to move on to another hospital, where he caused patient Jacqueline Troy's vocal cords to become paralyzed. She had to have emergency repair surgery. When Dunch moved on to yet another hospital, Dr. Henderson notified them of Dunch's surgery record. However, Dunch was able to submit recommendations he received from medical school. When contacted by Dr. Henderson, Dunch's former fellowship supervisor said that they responded positively because Dunch had completed the training satisfactorily. Not only were they not asked about Dunch's current actions, they couldn't comment on those actions. It was all hearsay. Meanwhile, a few months after his surgery, Passmore, no longer able to meet the physical demands of his job as a medical investigator, was forced to resign to access his long-term disability insurance. He began to investigate Dunch. A few other patients of the family of deceased patients consulted lawyers. However, Texas enacted tort reform in 2003, which capped plaintiffs' damages for malpractice at $250,000. Also, to successfully sue a hospital or a doctor for malpractice, it must be proven that the facility acted with malice, which can be incredibly difficult. The lawsuits that generally go forward hinge on economic damages, such as lost earning power power, which the law does not limit in non-death cases. However, many of Dunch's patients were disabled, older, or on Medicare insurance and had limited resources. It was hard to find lawyers that were willing to take their cases. Dunch managed to move on to yet another facility, University General Hospital. The last straw came on June 10, 2013, when Dunch performed a cervical fusion on a 49-year-old Jeffrey Glidewell. After the surgery, Glidewell had severe pain and trouble swallowing. Dr. Kirby did emergency surgery and found a significant esophageal injury that affected Glidewell's ability to breathe. He also found a sponge that had been left in the soft tissue of Glidewell's neck. Dr. Kirby quickly filed a complaint with the Texas Medical Board. Finally, an institution weighed in, and University General Hospital also reported Dunch. On June 26, 2013, nearly a year after Dr. Henderson first complained about Dunch and 3 days after Dr. Kirby's complaint, the Texas Medical Board finally ordered a temporary suspension of Dunch's license while they continued their investigation. Soon afterward, surgeons Kirby and Henderson made an unusual move. They met with a prosecutor at the Dallas County District Attorney's Office to discuss possible criminal charges against Dunch. Generally, physician discipline is handled by hospital, medical boards, and malpractice lawsuits. The doctors worried that Dunch would be able to get his license reinstated. They decided to use any tool at their disposal to make sure that didn't happen. On December 6, 2013, Texas Medical Board, having considered both evidence and a rebuttal report from Dunch, finally revoked his license to practice medicine. After his medical license was revoked, Dunch spiraled. He moved to Colorado to live with his parents and declared bankruptcy, claiming debts of around $1 million. In January of 2014, he was arrested for DUI. In March 2015, Dunch had a public breakdown and was taken for a psychiatric evaluation. In April, he attempted to shoplift some $887 worth of merchandise from Walmart and was arrested. When a local newspaper ran a story about him, in the comment section underneath the article, Dunch responded with several very long tirades against everyone he thought had conspired against him. Meanwhile, in the fall of 2014, the Texas Department of State Health Services, which oversees hospitals, began an investigation of how Dunch's employment and dismissal was handled by Baylor Plano, Dallas Medical, and University General Hospitals. Ultimately, the hospitals would get a slap on the wrist. On July 21, 2015, Dunch was arrested. Prosecutors charged him with 1 count of injury to an elderly person and 5 counts of assault. It was a challenging case to build because no surgeon had ever been criminally prosecuted for negligence during surgery. The authorities struggled to figure out what crimes he could be charged with. Dunch's trial began on February 2, 2017, and focused on the charge related to effort, injuring an elderly person. Prosecutors put several of Dunch's former patients on the stand, where their harrowing stories of pain and despair established a pattern of botched surgeries before he operated on effort. It took the jurors just hours to find Dunch guilty of intentionally causing serious bodily injury to an elderly person. He received a sentence to life in prison and will not be eligible for parole until 2045. Several former patients banded together for lawsuits against Dunch in the hospitals. They were able to receive some compensation, but considering the scope of what happened, it wasn't much. Aside from Dunch's hubris and ineptitude, extremely chilling about this case is the way hospitals handled him. The multiple layers of safeguards that were supposed to protect patients from a dangerous doctor failed. The hospitals were far more concerned about their bottom lines and reputations than the well-being of patients. Studies have found that bad doctors are underreported to the National Practitioner Databank. While Dunch is an egregious case, he's not the only bad doctor out there who's slipping through the cracks. Check out more of our videos. What happens when a doctor removes the wrong limb? Horrific injuries sustained during war helped spawn a whole new industry, plastic surgery. Find out more here.